what we knew, but we didn't know what we didn't know until we had a peer support specialist in the role to really help us understand like what it felt like we were kind of functioning with one arm tied behind our back.
A lot of times when a person is active in addiction, they're not going to the medical doctor. They're not getting dental care. They're not getting just regular treatment. So if we have that here for them and they're already engaging with us, they're more likely going to engage with the doctor too to get those primary care needs met.
From the primary care side, we want to look at their overall health, and we want to evaluate how their blood pressure is doing. If they're at risk of something such as hepatitis C or HIV, we want to make sure that we get them screened for that. So there's a lot of other things that we try to deal with from a primary care side.
If they have substance abuse disorder, then they also have mental health issues. Then they need to be in counseling. They need to be, they probably are going to have some other issues like smoking that we need to address. Maybe COPD that comes with smoking. We also need to address that. A lot of them have chronic pain that started this problem. So then we can address their chronic pain and get them into other avenues to treat their pain that aren't opiates. So I think it's actually the best place for it, because then they're getting the whole, they're getting primary care. We're treating everything.
Peer support always sees them first before I see them, so that kind of helps to find out where they were over the last week, 2 weeks, month, however long their last visit was. And they really keep track of them through the week. They help them with so many other things because they can't come in hopeless. They're homeless, they don't have identification, social security cards. They can't get around the system to find those, so our peer support help them with things like that. They come with so many different barriers, and so peer support helps with all that.
We have a lot of people that'll call us, and they might call us 2 or 3 times. We're kind of establishing a relationship with them. They're not quite ready to make that plunge and quit or go to treatment, and then I have the peer support follow up with them, and that contact and that just knowing that somebody's there when they need them, when they're finally ready, we get them in like that.
We really provide that relatable experience, get down to what's really bothering the patient, and during treatment team we're able to come together as a whole and put all our heads together about what is going to be best for that individual.
My day is probably going to mostly consist, well, it is going to consist of seeing about 36 patients. I have 3 GIPR intakes and 3 GIPR 6-month follow-ups. I'll be going in and out of rooms, talking to people. It's going to stay very busy all day. I've had to learn to do some time management, and it's just going to come in and out all day.
If they see something that kind of crosses that boundary from what they're comfortable working with, and they see it's more so of a mental health type thing, where it's a little bit over their head and they're not comfortable with that, they'll come straight to us and say, hey, I'm worried about this person.
It is a new experience for me, but I'm very pleased with the work that they do. They keep up with the patients. They're constantly texting or calling the patients to see how they're doing, if they're having any cravings, if they're at risk of using, and try to help them through that period.
If you can engage people and show them that there is recovery and there is an option, they might take it, or they might at least look into it, plant the seed. There's hope.
I mean, you see it every day when you're talking to a patient and they get that little glimmer in their eye or they're nodding their head. If I can give somebody a little bit of hope for them to know that it can get better, I mean, that's what I'm here for.
I did this for years without peer support. Doesn't mean we can't do it, but I think that the benefit is huge, And it also, it also gives the patient something to aspire to. Some people that are in active use are just not nice people. They're hard to work with. Nobody likes them. And then you get them into recovery, and they're different. They're 100% different. It's amazing the type of person they really are that's just hidden. And they're some of the most wonderful people that you'll ever meet. And so that's why I do what I do.